I'm going to share you some useful information in the tips and tricks series. The YAG peripheral iridotomy is a very commonly done procedure. We all use pilocarpine to constrict the pupil, so peripheral iridotomy becomes easier to do. But unfortunately, the pilocarpine availability is one issue. The second issue is on headache, when the patient having the headache post pilocarpine application. So I'll show you a small trick. See this video, the eye to be lasered is on the left. So when we show the light, the pupil constricts. Unfortunately, this is not sustained. When you show a light in the other eye, because of the consensual reflex, the pupil becomes very small. You can see a bright light in the eye to be lasered, and consensual also, you show the light, both the pupil becomes very small. This is a very useful trick when you are doing peripheral iridotomy without usage of pilocarpine. This works very well. Try it out. Thank you so much. Hope it is a useful trick for all of you.